Good job. You found it. Yes, this is it, the Glidescope. It's a device I'm sure most of you are pretty familiar with, as it's used pretty often for intubating on labor and delivery, and it's found in the substerile space. It's composed of a screen, a cord, and a reusable metal handle. The handle can be tricky to plug into, so often it's already plugged in and ready to go, but sometimes it's not plugged in and needs to be done. When intubating with a Glidescope, most of us will use a rigid reusable stylet in the endotracheal tube. Again, this may be ready to go in an endotracheal tube already, or it may be a standalone that needs to be inserted. There are several buttons on the front. Really, the only button you need to know is the leftmost button, which is the on and off button. Press it once, the machine is turned on, and you can see light is now going through the handle, and the video is projected onto the screen. And this is how we would be able to see the cords and intubate the patient this way. If you press and hold this button again, after a couple of seconds, the Glidescope will turn off. Lastly, there is a battery for the Glidescope, but it does need to be recharged. So we try to make sure that it is plugged in both at the back of the Glidescope and then that cord is plugged into the wall at all times. There's just one Glidescope on labor and delivery.